All right, we are live once again with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Doctor, thank you for joining us again this week.
My pleasure.
So we've got a lot of changes that happened just in the past 2 days this week. Lots of questions coming in about that. So let's jump right into it.
Okay.
Okay, so first, a big one that happened yesterday. The childcare centers across the GTA opened up. We heard that parts of Ontario are moving into stage 2, and a few of those things are applicable for the GTA, of course, mainly childcare. So Sarah asks, do you think it's too early to open up childcare centers, seeing how schools are closed for the rest of the year as numbers are going up since phase 1?
So childcare centers are going to be operating in a new space. It's not going to be as it was before. There are going to be new protocols that will be in place for childcare centers, and the ministry just released their guidance. So it's not going to look the same as it was before. There are definitely going to be additional precautions that will be taken for the children and the staff.
Okay, so it's not the same. And I believe that they're going to be restricted to groups of 10 as well, right? The same for gathering limits.
Right, so there will be some restrictions on numbers. The cleaning and disinfection, I mean, childcare centers are already very good, but that's been increased. There's going to be screening, so before you can even enter, in fact, parents won't even be able to go in and drop their kids off. They'll drop them off on the outside and do a screening form to make sure that everyone is healthy, that no one has symptoms as well. And if someone gets sick, they will be moved aside so that they cannot perhaps infect others. So there will be a lot of interventions in place. I can say with the emergency childcare centers that were in place, they were run very safely, and there was only one that ended up with COVID, but the rest of them actually were free of this infection. So it's up to each parent to decide whether they're ready to send their child there.
Yes, that's the other concern, is that they're open, but it's up to each parent. It's up to your own discretion. It's not that it's compulsory to send your kids back.
That's right. And you know, you'll also have to think about your own child. And, you know, if your child has existing medical conditions, you might be a bit more cautious, for example.
Absolutely. Christy also asks about phase 2 now. She doesn't quite understand. She says, we just entered phase 2, and I guess that's an all clear because everyone seems to be getting back to life as if it's totally normal, except my doctor's office and the dentist. They are still being very careful. So can we go to family barbecues with 50 people in a yard?
No, no, you can't do that. And in fact, not everyone has entered phase 2. So right. If you live in the Greater Toronto area, you have not entered phase 2. We're still waiting. What is going to be for the whole province on Friday is you can gather in a group of 10. That doesn't mean, though, that you can have 10 people and sit around a table and think that everything's okay. It means you can gather in 10, but you still need to keep that physical distance from the others if they don't live in your own household. Right. And for Toronto and the rest of the GTA, all of the other pieces for phase 2, you can gather, places of worship will open with reduced capacity, childcare centers will open, but most of the other things in phase 2 will have to wait to see when we can reopen in Toronto and the GTA.
Right, because it depends on how far along we are in the curve as well.
That's right. And so by Monday, we should have a better sense whether we might be opening up for later on in that week.
Okay. Another big thing that happened yesterday was that the Toronto Board of Health declared anti-Black racism a public health crisis. So first of all, what exactly does it mean when something is declared a public health crisis? And secondly, does that mean that certain resources are going to be mobilized? And what measures do you think need to be put in place to address and correct the inequities that Black Torontonians are facing in the healthcare system?
We know that this is not a simple fix. We know that there's no one thing that we can do to kind of make this right. And so by declaring it a crisis, what we're saying is this is something that we need to put more attention on. We need to consider an additional response to what we're doing because what we're doing is not enough. And so I think that's how you can interpret this. And so we'll have to now see what kinds of things can we do that will make a meaningful impact. Who should we be working with? What kind of things should we be measuring to make sure that we're actually making a difference? And we can even see for COVID, where COVID has impacted on some of our more broader analysis, racialized groups. And so even just for this one particular disease, what can we do? But also in the broader context, what more can we do?
So when it comes to those things, are we talking about, because there's housing, there's employment, there's health, there's so many aspects that go into affecting somebody's health and well-being. Will all those factors be looked at?
From a public health perspective, our goal is to be able to, recognize that many factors impact health, and to be able to work with our community partners, other people at the city, to be able to now start looking into it a bit more and to see what actually, what can be done. Where are some of the pressure points in the city in particular for this issue, to be able to start asking some of our other partners as well to start looking at it and to address it.
Okay, and so just coming back to what a public health crisis is, does that mean there's actually basically just more money going behind this? Is there more time, more research? What does it come down to?
Declaring it a crisis first and foremost means this is something that is pressing and it's going on right now, and we need to be able to look at it closer. And so that's the commitment that we have right now. And the rest of it, now we need to start developing a plan and figuring out how we can best address this.
Right. Okay. So this is the first step.
It's the first step, and I think, it's an important first step because you have to first actually be able to name it before you can actually do something about it.
Yes, absolutely. It has to be called out. Absolutely. So more about this past weekend, we saw a lot of protests in Toronto. We saw large gatherings of people. So JB asks, as the hundreds of people in protest become silent spreaders of COVID-19, is 2 weeks from today enough time to self-isolate? We resumed our daily strolls, but now we're afraid to go out again because we are part of the vulnerable population.
So the virus takes 14 days from when someone has been exposed to when they can get symptoms. And so if people got COVID at a place like a demonstration, you can expect that they would develop symptoms within 14 days. And so we're kind of in a wait and see. Definitely, even if you were at the protest or you weren't at the protest, but you have symptoms, even one symptom, or you were exposed to someone who had COVID, get tested. I think that's really important that we do. But I think the main message here is, no matter where you are in the city, we all have to continue to take precautions. And so you saw that some of the demonstrations were absolutely taking precautions. They were keeping 6 feet from one another. They were wearing masks. And I think that that's what we need to concentrate going forward.
Okay. Another question again about protests. Tim asks, we're about 10 days since the first George Floyd protest started. Theoretically, we should see a huge uptick in cases around this week. But if we don't, should that be a signal then that we can reopen even more things?
So I think we have to look at more than just the number of cases to decide when we're ready to reopen. And I think this is what, as a regional approach from the province, we'll look at. It's not just based on the numbers of cases, it's based on how many are in hospital, do we have capacity in hospitals, what's our testing like to get reports for cases. So all of those things we'll take into account when we consider going into phase 2. I think the one thing, though, even when we're ready to go into phase 2 and we reopen, it doesn't mean that we can go back to the way things were in March. We're still going to have to take precautions. And so I think that's the really important message. Even now, while some retail is open, even while daycares will be opening, it's going to be with new precautions.
Right. It's not going to be back to normal, I think, for a very, very long time, if we ever do get there.
That's right. Yeah.
So again, another related question from Nick coming in right now. Toronto Public Health reported no discernible increase in the Toronto infection rate after the event at Trinity Bellwoods, which we saw a couple of weeks ago. Now there were like 10,000 people out there. How can you explain this? Do we really understand transmission fully?
So I think one thing is when we look for the past 2 weeks where people have gotten COVID or where they live, we're still finding that the northwest of the city is where we're seeing more cases where people live. Even if you were at the park at Trinity Bellwoods, it doesn't necessarily mean that you live in that neighborhood. So that's part of being able to figure out what actually happened, because people from parts of the city, even who don't even live in Toronto, could have been at the park on that day. So I think all of these things are taken into account. There's no question that when you're outdoors, the risk of the virus spreading is less. And no question also that, if you were not infectious, then you won't spread it. So I think, maybe more and more people are staying home when they're sick, when they're having even one symptom, and that is certainly going to help in these situations to prevent the spread of the virus.
Okay. More again about spread and infection rates. Toronto and Ontario has not been able to get the RT, which is the reproduction number, under 1 consistently, but the government is talking about opening more and more. So why are we so behind? Because as public health, what are we doing to ensure that we get there before more things open up further? He says, according to Teresa Tam, under 1 for 3 weeks is when when it's considered that the virus is under control.
That's right. So the R0 is, we call it the basic reproductive rate, and it shows if you're infected, how many more people are you going to go on to infect? And so we saw in March, 1 person would go on to infect 3.5 people in Toronto. Right now, we're sitting at about 1. Until we have a vaccine, we may not be able to consistently stay under 1, actually. And so we have to be able to balance how much infection is going on in the community with the significant restrictions that are put on people's lives in being in lockdown. And some of the other considerations, like opening up the economy. We know that jobs are really important for people's health. We know that, being indoors has impacted people's mental health. And so we want to be able to balance that. Staying at an R0 at 1 still means there's infection. And I think that's going to be the case for a while. And so what we need to do is to be able to limit the amount of spread, and we need to have our public health capacity in place so that we find the infections and then to be able to do that contact tracing.
Right. So we are at 1 at this point in the city?
We're at about 1.1. We're definitely not at 3.5 where we were at the beginning of March.
So there's definitely progress. There's definitely some positive things happening.
Definitely, yeah.
That's really good to know. More about antibody testing. People are once again asking about antibody testing. Satish asks, there's been a lot of talk about plasma therapy and using it from recovered patients. Has Canada ventured down this path? And if the answer is no, why not?
I don't work in an ICU to know what people are doing clinically here, so I can't comment on that. But I do definitely know that we have big plans in place to do antibody testing in the population, and you've seen other countries do this as well to get a sense for how many people have immunity. There's 2 things to say about this. One is you have to make sure that you have a good test, so that you're clear that when you get the result and it shows that you have antibodies, that it actually means that you have antibodies. And so part of the delay here is making sure that we have a good test. And then we can start doing some of that surveillance testing, which is in the works. There are plans for it in Ontario, so we can get a sense for how many people may be immune. But again, even when you have those results, we're not clear if it says that you're immune, how long will your immunity last? And we're not clear on that right now. Is it going to last you for 2 years? Is it going to last for a few months? And so these are all questions that we're looking for answers for.
And so just related to that, then Margaret says, how far away are we? Do we have a timeline as to when we're going to start antibody testing?
I don't know the exact date for when that will be started, but there are certainly, the labs are doing validation. There is a test that has been approved by Health Canada. And so, I'll say just around the corner. It's not going to be months and months from now.
Oh, wonderful. Okay, that's pretty quick.
But to say that the antibody test that will be available will be for that surveillance purpose, for testing people in the population. I don't know of any plans right now to have antibody testing. If you think that you had it, to go to your doctors and get an antibody test, that I'm not sure when that might be available.
Right. Okay. And then after the antibody tests, whether or not we will be doing that plasma therapy as well. That's
right. Yeah. So the plasma therapy, I can certainly follow up on that for next week.
Okay, great. So this is a question from Anonymous. If there is a vaccine found, will we all be required to take it? Will it be mandatory? This is something we've heard a lot. There's a lot of concern about that.
We right now don't have a mandatory vaccine in Canada. And so to think that this vaccine will be mandatory, definitely not in the beginning. In the beginning, in order for it to be mandatory, we have to make sure that we have 35 million doses of the vaccine to be able to provide it to everyone. And in the stages, we won't have that much vaccine available. And so what we're going to have to do is try and figure out who is at highest risk, who will have the best response to the vaccine, and to be able to provide the vaccine to those people. But it will be with informed consent, so that you're aware these are the risks that we know of for the vaccine, these are the expected side effects, and these are the expected benefits before you receive the vaccine.
Okay, and that's the case with every vaccine. I don't think we've so far ever forced anybody to take a vaccine. So
that is our current standard in Canada, and I don't have any reason to believe that it will be any different for this vaccine.
Okay. So moving on a little bit now to hanging out with friends, contact tracing, that kind of thing. Alexia asks, if a person's household is work from home and each wears a mask when in public indoor spaces, are there still cases of them being infected? And if so, how? What activity in Toronto would be most risky in terms of contracting COVID?
So it's a good question. And actually, we know that for our cases, since May, most of 65% of those cases are getting the infection from close contact with someone who had COVID. And so that is the commonest reason why people are getting it, and they can identify a close contact. So if someone in your household were to get it, the likelihood of you getting it would be higher. Your risk would automatically increase. But that is the commonest way that people are getting the infection. They're not getting it necessarily just through walking down the street or through going to the grocery store while they're taking precautions, for example. It is that close contact where this is spreading.
Okay. This is a good one. This we've had once before. Annette asks, will Toronto start disinfecting streets and other public places?
So it's not the street per se that you walk on that is the risk. It's the surfaces that you touch. And so we certainly have a recommendation that what we call frequently touched surfaces, so lights, doorknobs, going in and out of places where you may touch, a grocery store cart, those things definitely have frequent cleaning and disinfection. Public washrooms, for example, we've given our guidance to Parks and Rec to be able to clean those at least twice a day. So that's the kind of cleaning and disinfection that is necessary for this virus and the recommendations that we have made.
Okay. So we're not looking at like mass washing of streets every night or something like that.
No, because that's not likely to be effective to prevent the spread of this virus. Yeah.
Right. So some questions about kids now. Barry asks, Kawasaki disease afflicts children. Should they be required to get a physical examination before finally returning to school whenever they do open?
So COVID can impact some children and give them this multi-system inflammatory condition, which is like Kawasaki's disease. Interestingly, some of the children who actually get this, and it may be related to COVID, actually have a negative test for COVID. So we're not quite clear. It could be that they had the infection even weeks before and are developing an inflammatory response. And so the likelihood is actually they're probably not even that infectious when they actually get the inflammatory disease. But there's no question that for every case of COVID, Toronto Public Health does an investigation and gives a recommendation for when, and actually tells them when they're cleared and no longer infectious.
Okay. Nancy asks, is it safe for me to look after my grandchildren now I am 65 years old?
So the risks for COVID are continuing in our society, in our city, higher in the GTA. And the older you are, the more COVID can impact you. And so I think every person has to be able to make those decisions on their own for their level of risk and recognize that the older you are, if you get COVID, it can be more severe.
Right, absolutely. Lydia asks, what happened to the early reports that taking Advil or other anti-inflammatories was having a negative effect on people who had the coronavirus? Is that still an issue?
Those reports are still present, and so I think it would still, and we've seen that for some other viral infections that, aspirin can sometimes be not a good choice, and sometimes Advil as well, because it can especially impact the kidneys because it's an anti-inflammatory drug. So what I would say is if you have a fever, you're not feeling well, and you have COVID, start with a different medication like an acetaminophen or Tylenol. If you can tolerate that, and if that's safe for you, that might be a better choice.
Okay, that's good to know. Yeah, because a lot of people have their go-to brands, whether it's Advil or Tylenol, and you don't always know the difference because it kind of does the same thing mostly.
Yeah, and the best thing actually is to really talk to your doctor or healthcare provider about this.
Absolutely. So we've got a few like personal health questions almost. Kapil asks, he has asthma that is related to year-round allergies and he takes puffers regularly. He works in transit and crowding can be quite an issue. How safe is it for him to go to work every day? And if he contracts COVID-19, what would his recovery look like?
So I think if you work in a place and you're worried about getting COVID in that place, you should talk to your employer because you can certainly do wear, for example, PPE or personal protective equipment to help prevent the spread. And so I think that employers would definitely be willing to provide extra support and protection for people who may be at higher risk of getting a severe illness. For example, someone who has asthma. I think there's no question that taking precautions is really important.
So speaking of PPE, we have a few of these questions. In the beginning of this crisis, we were told that PPE was running really low, especially for healthcare professionals. Where are we on that front now? Do we have enough PPE? Do we have local vendors? How are we doing in Toronto?
The message still is that the health grade PPE, so surgical masks and N95 respirators, we should be saving those for healthcare because we definitely need those in those settings preferred and do not want to risk running low on those. That is one of the metrics or one of the indicators that we have for hospitals to see what supply of PPE do they have on board. And so we that is definitely a real issue. There are, though, on the Ministry of Health's website, there is a link for employers who need PPE for their staff, not necessarily medical grade. Like, for example, in Toronto, when we hit phase 2, barbershops and hairdressers will be able to open. But Toronto Public Health is requiring that staff who work there and customers who attend there wear a non-medical mask or face covering, like a cloth mask. There are disposable non-medical masks as well that can be considered as well.
Okay. Another health question here. Amanda asks, how is COVID different from pneumonia? I had a mild cough which turned into pneumonia 5 years ago, and I've had compromised lungs ever since, and I get pneumonia almost every year. She's trying to figure out how COVID is different from pneumonia because she seems to have pneumonia almost on a yearly basis.
Mm-hmm. So what pneumonia actually means, an infection in the lungs. That's what pneumonia means. Pneumonia can be caused actually by lots of different things. So COVID can cause a pneumonia. It can cause a specific infection in the lungs. There are bacteria that can cause pneumonia. There are other viruses that can cause pneumonia as well. If you're a smoker, you might be at high risk for pneumonia. There are a number of, if you're older, you can be at high risk for getting a pneumonia. There are a number of things that can put you at high risk for getting a pneumonia. But the cause of the pneumonia can be from lots of different things, and COVID can be one of them.
Okay, so pneumonia is sort of a result of a particular virus affecting your body, whether it's COVID or whether it's anything else, or like you said, a bacterial possibility as well.
That's right, and most pneumonias are from an infection. Sometimes you can get them from like a chemical pneumonia, from or an aspiration pneumonia, we call that. But most of them are from infections.
Okay, a couple more questions now. We have a little more time. More about opening up and things that people can and can't do. B asks, can I teach hands-on swimming lessons in a private pool to non-family members?
The recommendation is no. The recommendation is that you need to keep 6 feet apart from non-household members. And so you can have family members be in the pool to provide that, if the child needs support to learn how to swim with your instructions. But the recommendation is that you as an instructor keep that 6 feet distance from others.
Okay. And then L asks, when do we anticipate Ontario will enable 2 households to bubble without physical distancing, similar to what many other provinces are allowing? That is, grandparents spending time with their grandchild and their parents.
So right now on Friday, we're moving to, you can have a gathering of 10. The gathering of 10, though, if they're not in your household, means you have to keep that physical distance. Mm-hmm. The bubble, a different idea. It means that you might have another household that it's like your second household. You would, in that situation, in the bubble, you can interact without having to keep that physical distance. Right now in Ontario, we don't have a recommendation for a bubble, though it may be coming. And so maybe by next week, we'll be able to say something about it. But right now, we don't have the bubble recommendation just yet.
Right. And I think it's important, you've mentioned this a couple of times, things could change very quickly, right? We've already seen the changes from next week to this week. Once again, next week, we might have some more things. So I guess people just have to be a little patient.
That's right. Yeah.
And I guess you've already answered this, so I'll just say it because Liz is asking, do the restrictions on social gatherings prohibit grandparents seeing their grandchildren in their homes? And I feel like that's kind of what you just mentioned as well.
Yeah, I mean, you're quote unquote allowed to do it if it's less than 10, but I would still recommend that you take the precautions. And I think outside of your home is going to be safer than inside of your home. And even though you want to give your grandchild a big hug, you might want to take precautions. Both of you wear a mask, wash your hands beforehand, give the hug, and then go back to that 6 feet distance. We're just going to have to be extra cautious.
Absolutely. Ross asks, when will it be safe for someone who is immunosuppressed, people who've had transplants and things like that, to resume normal activities like work and outside activities?
So because you have had a transplant and you're on medications for the transplant, you're at higher risk if you were to get COVID to have a severe illness. And so just like based on age, if you have a chronic health condition, you're going to have to take extra precautions. And that's going to be until we know that COVID is not spreading as much and that we have a better handle on COVID. And that's not just yet.
Right. And it's hard to tell with timelines when the question is when. I feel like you can't say 1 week or 2 weeks or whenever. It's just whenever we get there.
And it might not be until we have a vaccine. So, I try not to predict or to say it is or it isn't, but we're just going to have to keep taking precautions. And if you're more vulnerable, take even extra precautions.
Absolutely. I think we're almost out of time. So just this last one, Marlene asks, is it okay to drive in the same car with friends if everyone is wearing a mask?
So when you wear a mask if everyone's wearing a mask, you're reducing your risk. When you wear a mask, you're actually keeping your germs to yourself. If you really want to go in a car with your friends, what I would say is make sure that no one has symptoms. We actually have a screening form on our website for 8 symptoms. Get everyone to fill that out to make sure everyone is healthy. If you have a tickle in your throat, don't go. I think that's one thing. Wearing a mask will be helpful. Wash your hands before you go. If you can, have the driver in the front, someone sitting in the back, keep the windows open. I mean, those are precautions that you can take. But again, as I said last week, driving in a car with someone is close contact. You're typically driving for more than 15 minutes. And so you really should only be driving in a car with your household contacts, or you can expect that you could get infected.
Right. Okay. So on that note, we'll wrap up today. Thank you so much again for joining us, Dr. Dubey. We'll have lots more questions again next week, I'm sure, and anticipating the changes next week as well. I'm sure people will have a lot more to say. Thank you so much.
Okay, my pleasure. Have a good day, everyone.
Good day.